Were not there in the seminar session. Some of you, yeah.
You watch in the YouTube.
You were there in, you watched on YouTube. Okay. Okay. May I know your name?
Finish.
Anish, okay. What's your like educational background and what you're doing currently?
I'm working as an insurance coordinator.
Okay, you are already in the
Yeah, I'm a registered nurse.
sorry,
Nurse also.
nurse as well. Okay. How long you have been into this insurance coordinator?
More than like 8 years.
You have experience, okay, but you are not yet certified.
Uh,
And you see, okay,
I can.
same as him. Okay, how long?
We have 12 experience.
Okay,
Previous, I just right now.
okay, okay. So you both are working here in Qatar.
yes.
Yes.
Okay. And you? Yes.
So my name is Mariam and I'm previous graduate. I have a license, general dentist license here. I was working till last year and currently I'm not working.
You're not working, so you want to
I
be,
just wanted to explore more career opportunities in a different category.
okay. Did you go through the seminar session?
I could go through.
Yeah, okay. There I have briefed about the career opportunities, what are the benefits in this field, and all those stuffs I have already discussed. So today I'll not be discussing much into the career opportunities, okay? We'll have a glance on what is the CPC certification and what are the requirements like in the sense of knowledge area. So in which knowledge area you have to grade yourself to crack the exam. So what are the areas and what is the weightage for each knowledge base? Okay, so that is the key point that I'll be discussing today. So in this first class, since it's the first class, there are yet some of them to join. So that's the reason I'll not be going much in depth. We'll start with some of the medical terminologies. So most of you will be already aware of. We'll just go through those and just start with basic anatomy. In CPC, you have to keep it in mind that anatomy will be there, the weightage will be very less. So just the basic I'll be covering. Okay. So, and already those who are into the field, they'll be already knowing, and I know most of you are of life science background. So you will not be having much of a difficulty to learn all those things. It will be easy for you. Okay, so we'll just quickly start with what is this CPC exam. So are you aware, any one of you know how much questions you, how many questions you will be receiving in exam? What is question pattern? 100 questions? Okay, 100 questions, that you're right. 100 questions, you'll be having 100 questions in the exam. And the hour of exam, how many hours you will be having is 4 hours. Okay, and it will be a open book exam. So that is, you will be given in the exam centers, you will be given all the required books. Those are 3 books which I already discussed. Okay, which are those books? Okay. So as I told, it is a 100-mark question. Okay. So, and the passing mark. How much is the passing percentage for this one?
77.
Yes, it is. You have to clear. Sorry, not used to this. Okay, so 70% pass marks you have to get. And then coming to how many questions? 100 questions, pass mark 70%, and what is the pattern? So the pattern will be MCQ. Okay. MCQ questions. And then what are the three books? You already know those. What are the three books?
Read and see.
CD 10 CM. Okay, then you have CPT. Then you have fix. And then two. Okay, these are the three books that we will be referring. What we have in ICD 10 CM is the diagnosis coverage. There you can find all the guidelines related to each chapter. You will be having 21 chapters. Okay. So the chapter will be like based on one you'll be having respiratory system, another one will be circulatory, and the divisions I'm talking about. Okay, circulatory, that in depth I'll be discussing. Okay, but much of our focus will be on this area because CPT carries much of your weightage. Okay, each chapter wise. ICD 10 CM you will be having altogether might be seven marks and another 3 marks. I'll just check and I'll let you know. Okay. It'll be total of 10 questions that you will be receiving from ICD 10 CN. The rest will be AAPC. Then you have compliance regulatory, anatomy, physiology. Okay, all these things. I'll be going through all of those in depth again. Okay. So ICD 10 CM carries less weightage. So I'll be just briefing you through the guidelines. Okay, in the book, you will be finding all the guidelines. Even if you don't memorize, you can have a check. Okay, even in the exam, you can check those guidelines and you can apply accordingly. Okay, so that is one advantage. So it will be very less. But the thing is, if you learn it beforehand, you'll not have to waste time searching for the guidelines in the exam. So just go through all the guidelines. Okay, we'll be discussing. So it is based on, as I told, system wise. So we will be having respiratory, circulatory, then we have OB-GYN, then we have newborn. So those are specific guidelines that we have. Infections. The first chapter will be infection. You know, the sepsis, all those Zika virus, all those stuffs will be in the first chapter. And how is the book pattern? When we open, book will be provided to you. Okay. From the coming classes, you will be provided with books and you will be also given the soft copies. Okay, that is what the management have discussed. So it will be provided to you. So in the books, if you see, it will be guidelines. Then you will be having alphabetic order. So it is like diagnosis from A to Z. Okay, from alphabetic order. Within that, you will be having under sub terms. Okay, main term will be there. Under that, there will be another sub term again. Under that, there will be sub terms. So it will be like in-depth specification. So for example, if we say sepsis is one of the diagnosis. So sepsis, anyone knows the code? So there is a code for sepsis 419 and so on. Okay. So how will be the code pattern will be alphanumeric combination. Okay, it will be alphanumeric combination. The first letter will be with an alphabet followed by two numbers dot followed by another three numbers. Maybe three or four, it depends. Okay. Two, three, or four, it depends. Again, all these, numerics, which each of them has specificity in it. So as you go indeed specified, you will be having different digits. The number changes. So in sepsis, if you see under sepsis, you will be having, there is sepsis in the board. Okay. The first term is sepsis. Under that, you will be having sepsis due to organism X. Okay, let the organism be some other organism is mentioned. Due to an organism will be mentioned. Another subterm will be there due to organism Y. So it is specified. So you have to check in the question what is the organism for sepsis that they are mentioning. So if you in that case, if the question says sepsis, the person is coming, the patient is having sepsis, and the sepsis organism is due to X. And if you go and quote this, your answer will go wrong. Okay, because the specificity changed. You are going to quote sepsis with X organism. Yes.
You're only writing that code only in the exam, right? Only the code or
You will be having MCQs.
only T.
You have to choose the out of four. You will be having one question and four options. That is how the pattern is. One question, four options, out of which you can easily eliminate two. By looking at the codes, you will be able to identify. You will be very much confused with another two codes. Be more closely, likely, same. Okay, will be likely to each other, the another two codes. So there again, you have to choose it. That's the reason, now at this point of view, if I say the exam, to clear the exam is easy because it's multiple choice. AAPC is planning, as I discussed in the seminar session, you might remember. So AAPC is planning to have it fill in the blank style. Not now. So it's the plan because they are coming up to, they came to know that people are easily clearing the exam, but they are not able to apply it in real time because they are choosing the best option. Two, they can easily rule out. The third and fourth, they can you can see the answer, you can go back to the question, you can check in the book, the open book that you have, the book. If you refer the book, if you go with the option, you can easily tick the answer. So in real time and in the exam, these two are two different. Okay, so if you clear the exam, that doesn't mean you can be a good employee. So you have to gain or you have to keep updating because you also know that in every year October ICD-10 CM gets updated. Every next year CPT gets updated. You'll be having new add-on codes, added addition of codes will be there. You'll be having deletion of codes. Some of the codes will be there in 2024, might have been there in the 2024, but if we see in 2025, those will not be applicable. So it keeps updating. Okay. Next thing is revision. Okay. Some of the codes might have been with lesser specificity, but coming to next year, they would have revised the code saying that so and so can be added. The digits might change. The, alphanumeric after the point, after the dot, A419, something like that. After that dot, there will be some digits that might change. So you have to, update yourself with those. Okay. So one thing is that. Another thing is, as I told, this will be having lesser weightage than tick picks. This is the least weightage that we will be giving. You will be hardly having 3 questions out of HIT picks. So HIT picks is what? Additional services supply scope. Okay. Additional services and supply codes will be here. So your diagnosis is done here. Then supplies. Okay. Supplies is done here. The main content of CPC exam is CPT. Here what you will be having is, you will be having chapters again. Okay. And what are the chapters is, most of the coverage will be from the surgery. Okay, the procedures, surgery procedures that doctor performs. So major weightage will be surgeries. Then you have medicine. Okay, then you have pathology and laboratory. Okay, then what else? What is there? Surgery, other, yes?
Anesthesia.
Yes, anesthesia and another, yes, radiology. Okay, that is also most important. What we usually apply in hospitals are surgeries, radiology is much of what we apply in outpatients, you know. So another one is
Procedure.
anesthesia codes in OT. Okay, anesthesia code. Here we have package codes. In hospitals, we have package codes for surgeries where anesthesia is included in it. Yeah, so anesthesia will not be coding, but there are chances in future that all the systems that we are following in Qatar as package codes, you know, package codes are, it's not unique. It is unique to each hospital. It is not unified. It is unique to each hospital. So we don't have any standards for that. But in future, the chances are that package code will be either removed or it will be replaced by CPT codes. Or the base will be for each package, the base will be CPT code. That might be in future. Okay, so in CPT, as I told, these are the subdivisions. Okay, so each chapter 10,000 series. 10,000 series is for surgery of integumentary system. Okay, then you have 20,000 series. You mean, I mean the 10,000 series is, it starts with 1. 100, 103, 162, something like that. If you see, okay, sorry, there is no 2, okay. If you see something like this, you know, that means it is from integumentary system. That is 10,000 series, 20,000 series. What is 20,000 series will be musculoskeletal. What is 30,000 series will be respiratory and cardiovascular. So it is system-based surgery codes division. Then you have radiology, which starts with 7, you know, 7. So you can identify it falls under which category. Another key area and which one of the most complicated area is E&M codes. E&M guidelines are bit of a confusion, but if you learn it properly, you know, you understand the concept, it will be easy for anyone to grasp. E&M is also one of the part in CPT. Okay, E&M and what do you know what is E&M codes? Any understanding on E&M codes? So E&M is evaluation and management. Okay, so when a patient comes to a doctor, the consultation that is happening. Okay, face-to-face consultation. For example, the E&M codes looks like this. 99214, which says outpatient face-to-face consultation based on the MDM. MDM is medical decision making. Okay. How we identify the MDM? We'll look into that when we go in depth in the chapter. I'll make you understand what it is. So based on outpatient, if you see, you have to identify whether the patient is established patient or new patient. Again, based on that, there will be different codes. If new patient coming to outpatient service, coming with a face-to-face evaluation, and the duration of face-to-face evaluation is 15 minutes per scene. Okay, or less than 30 minutes per scene. And the MDM that units cracks is XYZ, that are the expectations met. Okay, MDM met. Then the code will be ABC. Okay, it's not ABC, it's 99214, 99212, 99213. It varies. Okay, it will be ABC for say ABC, but the same patient, okay, coming with face to face all these MDM is met, everything is met, and the time is different, the code will change. Okay, so each factor defines the code. It keeps changing. So that is what in the exam, what you have to see is what is the most specific that goes with the question. Okay, even if you miss any one of the word, you miss the time, or you miss the organism, or you missed the site. No, the site. Firstly, even in the site, in depth, you will be knowing in the organs, specific organs. Within the organ, the site is also specific. Okay, the lobes are specific. So all these things you have to be very careful about. If you make any change, or if you make any, misinterpretation of the question in that area, if you have any oversight in that area, this will lead to a wrong code. So that is the key area. What is the key understanding of this exam is you have to be very specific with what is the question. Each word in the question is very important. Okay. So coming to pattern, you can note it down. So how the exam pattern will be usually. Okay, first one, medical terminology. Medical terminology will carry 4 questions. So what is medical terminology? The very basic, you are into this field, insurance coordinators, you will be knowing what are the medical terminologies that will be applying. What are they? What are they? Everything that we say in the hospital is a medical terminology, isn't it? So abdomino, the terms like abdomino in abdominoplasty doesn't come in a normal. When we have normal interaction, we don't use those terms. But when it comes to our work, when it comes to the exam, we are using such terms: abdominoplasty, something like paracentesis. These are medical terms. That is what medical terminology understanding. Okay, we should be knowing what does that mean. Centesis means what? What is centesis? Synthesis? Paracentesis, thoracentesis, you'll be knowing already. Yeah.
Aspiration somewhere.
Yes, exactly. It's fluid aspiration, or we call it a removal of fluid from a particular region. From thorax, if you say thoracentesis. Thorax is, yeah, aspiration, remove from thorax. If you remove the fluid, then that removal of fluid is known as centesis. So this is a combination of 2 words. One is the organ or the site, thorax, and the other one is, because this is very important to understand, to have the, the crack to crack the exam, and also to understand CPT. If you have to understand what is there in each surgery, you have to have an understanding on the medical terminologies, else you will not be able to identify. Okay, they might have, in the question they might have given, okay, there was removal of fluid from, instead of thoracentesis, they might have given, there was removal, patient came for so and so, identified so and so, and there was removal of fluid from the thorax. Okay, in this case, there is no synthesis. How will we want to enter it? In the CPT, if we search, it will be thoracentesis code XYZ. Okay, but in the question, you couldn't identify, there was something like thoracentesis. But there was the explanation of it. How was it removed? So you have to understand what is the process, the procedure process. What is the root operation? Okay, root operation in the sense, what is root operation in surgeries? Approach in surgeries? Yeah.
Right.
Root operation. No, it is the method. How do we do it? So this removal of fluid is one of the root operation. Synthesis is a root operation actually. What is happening is removal of fluid. Another one is ectomy, appendectomy. Okay, what is the root operation? Yeah. No, those are approach. Okay, so identify the difference. Endoscopic, laparoscopic, open.
Yeah.
Okay. Yeah, those are approaches. Okay, you have to, you will be, like, you will have to understand the approaches as well. And another one is root operation. What is root operation is, as I told in appendectomy, what is the root operation? Yes, it is ectomy, ectomy, removal of the,
Appendix.
yes, organ. So that is the root operation. So in one medical terminology, see what and all you have got. You understood what is the organ, you understood what is the procedure done. That is what is the root operation. Then if it is mentioned as laparoscopic appendectomy, you will even get to know what is the approach. So this much detail a terminology can give one person. So, and depending on that detail, the codes vary. Okay, that is the key understanding of this entire CPT book. Okay, that is how the codes are defined. So first one I finished, it is medical terminology, 4 questions. So there you will have to understand the medical terms across all the bodies. Okay, body system. Then you have anatomy and physiology. Anatomy is the, what are the organs, what are the contents in one system, and what are the things, and so on. Physiology is,
Functioning.
yeah, very basic thing. Okay, anatomy and physiology. So this is the knowledge of anatomy of all the systems of human body. So what is the weightage? 4 questions. Anatomy and physiology. Okay. Next you have compliance and regulatory. So what is this compliance and regulatory? Any idea? With the term regulatory compliance.
Guidelines.
And applications.
Yes, sorry.
Laws and rules for.
Yes, rules. Okay. What are the rules and regulations kind of compliance? What are the things that one should follow, not to follow? Okay, what should be there to understand? Since it is US coding system, it will be much of related to Medicare. Okay, Medicare and payment policies. Okay, Medicare insurances, what are the defined rules and regulations in such payment regulations and so on, insurances. Okay, so compliance and regulatory, it is the rules and regulations that you will have, and you will be having 3 questions from that. You will be having so many questions like fraud and abuse, what one should not do in medical, using the medical reports, what one should not be doing, what one should be doing while submitting the claims, what one should be doing, what one should not be doing. All those things will be there. Okay, claim submission, payment, receivables, all those related questions will be there in this part, in this area. Okay. So how many questions? 3 questions. Next, you have coding guidelines. As I told, all the guidelines will be available in the book. It is there. Even if we see for CPT, for each chapter, there will be guidelines in the book. But the thing is, you will not be able to search the guidelines in the exam because you have time limitations. You'll not be able to search it there. If you have everything in mind, at least the guidelines in your mind, you will be able to search the codes, because searching the code itself will take you time. So if you go and search the guideline there, then you go for the, searching of codes, it'll, you will not be able to finish it in 4 hours. That is the key understanding. So you will have to know all the guidelines beforehand. So, coding guidelines, that will be CM or CPT. You will be having 7 questions. Okay. In the CM books, you might be knowing there are something like parenthetical notes. In CPT, if we come, there are modifiers. Modifiers we are not applying in Qatar in real time. But there is modifiers as per US guideline. 59 modifier, 50 modifier. What is 50 modifier is bilateral. Okay, if there is, you know, total knee replacement performed, okay, TKR is performed, and you want to mention it as bilateral, you can give modifier 50. But in real time in Qatar, I'll make you clear with this that we are not using modifiers. But for exam, we require this. Okay. But if you go to US coding, that is mandatory. If you don't denote that this is the thing, this is the modifier for each case, you will be facing denial. For sure, you will be facing denial in US coding. But here we are not much in depth of all these applications. We are not using, even in Qatar, we are not, much of involvement of all the guidelines. We are not using much of the guidelines that we learn. But for cracking the exam, it is required. Okay. So that is done. So
Excuse me, for this one coding guidelines, how many questions?
seven questions. Okay. So all the guidelines, CPT, parenthetical notes, modifier use, everything comes in there. Okay. Next you have ICD 10 CM questions. Okay, purely the ICD 10 CM book. There that you will be having 5 questions. So there you will be tested with scenarios like some of the questions will be given where you will have to identify the exact ICD-10 CM code. Okay, diagnosis code. Next you have HCPCS level 2. That is again 3 questions. So in that HCPCS also you have modifiers. So modifiers, the guidelines, the supply medication, all those stuffs will be there. Fix all together. The 3 questions. Next you have CPD. Now coming to our main area of knowledge, that is CPT. Okay, in CPT, first one is 10,000 series. Okay. You can mention 1 followed by 40. Okay, in that 10,000 series are what? It is integumentary system. The surgery is related to integumentary system. That will carry 6 questions. Done. Next, 20,000 series. That will carry again 6 question, which is musculoskeletal. Surgery related to musculoskeletal system. Integumentary, you already know what is it related to? Okay. Okay, all the tissues in those stuffs. And musculoskeletal, of course, the name says it's bone. Then next one, 30,000 series. 30,000 series, again 6 question. So this one is surgical procedures related to respiratory